Hi, I'm Steve Showalter with Showalter Property Consultants, and I'm here with Dr. Daniel Johns, and we're going to try to help educate you about mold.
Yeah, so I'm Dr. Johns. I'm a chiropractor and integrative medicine practitioner. We treat lots of mold patients, lots of biotoxin injured patients. And what happens a lot of times is patients don't realize that the symptoms they're having can be traced back to mold. And a lot of times people just think mold will give you a cough, when in fact it can give you a whole plethora, just a ton of different types of symptoms. So you can have everything from interstitial cystitis, which is bladder pain, to chronic urinary tract infections, to brain fog. I've had lots of people with different skin, just eczema comes out of nowhere. They haven't had eczema at all in their life, and then they're just breaking out all the time, to joint pains. You can't have the coughs and the chronic sinus infections and all of that, but it does such a good job, mold does such a good job of attacking the body in so many different body systems. There are just a ton of symptoms that can go hand in hand with mold and mycotoxins and biotoxins. One of the big ones that people don't think about is mold causing depression and anxiety. There was a study done in Finland where they looked at people that were showing up to the doctors with with anxiety and depression, and then they were going back and looking at the houses, and you were 60% more likely to show up to your doctor for anxiety and for depression if you lived in a moldy environment. So a lot of people are attributing this to hey, it's post-COVID, I'm spending a lot more time at home, so yes, I have depression, I have anxiety. It might be your home. That's where this might be coming from.
And we are seeing more people that are working from home, spending more time at home than they ever have. A lot of people bought homes without home inspections, and now they're finding out they have a problem. And a lot of people don't realize how much moisture and humidity can affect their home and have never been properly trained how to control it. So somebody comes to you with these symptoms, what do you do? What do you offer?
So the first thing we do is we take a really detailed history, because a lot of it comes down to asking the right questions and thinking about when did these symptoms begin? Do they get better when you go on vacation? Do they get worse when you go to, a friend's house that lives right by the water, or those kind of things? So we start to look at the history as a whole, and then there are a lot of blood tests that we can run to look at, are you really inflamed? Do you have specific elevated biomarkers that are attributed to mold? We can also do a urine mycotoxin test. There's a lot of different tests we can do, but it starts with let's figure out really where this is coming from.
So full disclosure, Dr. Johns actually did some of the treatments on me, and I saw a remarkable difference. I used to go into homes that had mold, and I know that I'm allergic to aspergillus, and I'd end up with a sinus infection. And now I'm going into these homes or buildings and having mild symptoms that dissipate pretty rapidly now. So what are some of the other treatments that you offer that you performed on me that helped?
Yeah. So we do a technique called NAET, N-A-E-T, and that helps retrain the central nervous system so that the immune response is able to identify mold and mycotoxins and react to it appropriately instead of flipping out and giving you all these other symptoms. We use something called the IV laser, this little guy back here. We're one of 2 clinics in the entire state of Maryland that have one. That's super common in Europe, but that will boost your endogenous immunoglobulins. So it fixes your immune response from kind of the ground up so that your body's able to actually handle these moldy environments. You absolutely have to get out of a moldy environment if you're in a moldy environment, and that's where it started. But the goal is to fix your immune response so that you can go back into moldy environments. You should be able to go to your friend's house. You should be able to do a mold inspection and be there. And you might be like, oh, this is a moldy environment, but we should get you to the point where you don't have all those symptoms and it doesn't ruin your day.
And it's important to find out where the mold is. It could be at your home, your office. We've had them in people's cars,
Absolutely.
RVs, and boats. So it's important to have a mold investigation and testing, but it's good to have a resource to be able to go in and have treatment, because a lot of doctors don't listen to you. And I can tell you firsthand, Dr. Johns, because he's had a personal experience with mold, has a lot of empathy with it.
Well, I think too, one of the things to think about, you have to look at all your environments. You have to look at school. You have to look at your home, your friends' homes, your work, car, all of that. But something to remember, mold can stay in your body. Mycotoxins can stay in your body almost indefinitely if you're a poor detoxer. We've had people that have been having symptoms for 20 years, and we talk about where they were living 20 years ago, and they're like, well, we had a really bad flood in the basement, and I started getting symptoms after that. But we moved out of that house a year later. But they maintain those symptoms that entire time because those mycotoxins are just stuck in their body. So until we can help open up those detoxification pathways and get the mycotoxins, get the mold out of their body, they don't get better. So that throws people off a lot of times too. They're like, well, I've been out of the moldy environment for 2 decades. It can't still be the mold. It can still absolutely be the mold.
But you're also dealing with multiple infections sometimes too, because you have spoken about PANS or Panda syndrome.
Yeah.
And if you want to elaborate on that,
Yeah.
because of Lyme disease.
Yeah. So PANS is pediatric acute neuropsychiatric syndrome. PANDAS is pediatric acute neuropsychiatric disease associated with strep. So your child gets strep, and it's sudden onset. It's usually like overnight. They go from your normal, loving little child to having these psychiatric symptoms, and that can show up with rage, tics, seizures, severe OCD, ODD. And it just comes out of nowhere. And that can be, PANS can be a really big trigger from both mold and Lyme and co-infections and that sort of thing. So we, as someone that treats mold, you also have to be familiar with and be able to treat all these other co-infections that come along with it. If you have mold, you're much more likely to be susceptible to Lyme, to the co-infections that come from other tick bites. As well as heavy metals and all of that. So we kind of like to take a whole approach. We can't just treat you for the mold because you probably have some of these other issues going on as well. And that's where the IV laser does a fantastic job at killing off any bacterial infections circulating in the blood. It does really well with Lyme and co-infections. We use a lot of other tools here. The NanoV here is activated water. They use it in a lot of the NFL training locker rooms now for recovery. So they do a really intense workout. This helps to refold broken proteins. It has a ton of research behind it. And being able to boost your heart rate variability, VO2 max, all that. So it's strengthening your body so that you can mount this attack against, whether it's a biotoxin or Lyme or chronic strep infection. So we utilize a lot of these different tools to try to move things along without having to go on really intense antibiotics. And truthfully, if you have chronic Lyme, antibiotics just don't work anymore for you.
Great. And you had mentioned you're getting trained in a new procedure?
Yeah, so I'm undergoing training right now for LENS neurofeedback. It's low intensity neurofeedback systems, and it's a way to use EEG. So the little things that you see on TV when they're looking at someone's brainwave function, and it inputs a very small electrical current to balance out those brainwaves. So we're looking at, okay, where is there dysfunction in the brain, and how do we fix that dysfunction so the brain can start to heal itself? It's very different from traditional neurofeedback. Traditional neurofeedback, you're sitting in front of a computer and you're doing a task to try to train the brain and get it going in the right direction. LENS is completely passive, so we can do it on kids because it can be done in as little as 2 to 3 minutes. They're literally just sitting there. We have the sensors on their head, and it untrains faulty movement patterns instead of trying to retrain new patterns. So we look at the brain and say, okay, there's a blockade somewhere. We're going to take out that block so that the brain can reorient itself and heal itself. The brain is amazing. It has, just crazy capabilities to heal itself. A lot of times what happens is we're stuck in this faulty loop. And if we can break the loop, then the brain all of a sudden is like, I get it. I know how to fix this. And I mean, they see progress in as little as 6 to 10 visits with anxiety, with autism spectrum disorder, with ADD, all sorts of things. So we can use it for those patients that have post-traumatic stress syndrome or disorder from being in a moldy environment, because it does create a PTSD response whenever you go back into a moldy environment. Even if you're healed, you're completely fine, as soon as you go back into that moldy environment, the body flips out and says, this went really poorly for us before, and people will get immediate symptoms within like seconds of walking into a building. So this can help to retrain that so that we get rid of that sensitivity and allow you to function in a normal way.
And how can somebody get a hold of you if they do want to come in and meet with you and set up an appointment?
So we're at Elevate Life in Annapolis. If you go to elevatelifeclinic.com, you can submit a request through the website. You can also call us at 410-268-3333, and you talk to our manager, and she'll walk you through kind of our options and what kind of appointment you need to schedule and that sort of thing.
Awesome. Well, thank you so much. And again, my name's Steve Showalter, Showalter Property Consultants. We do offer mold testing and investigation, but I firsthand recommend Dr. Johns, as he has definitely helped me with my health. Thank you so much.
Thank you.